These guys belong in the 60s. What are you doing here in 2024?
Seeing especially like young kids who start antidepressants, it's like a lifetime cycle usually. So
Man, I'm learning stuff out here on these streets, man. What if I told you that there were natural options that could work just as well in conjunction with some behavioral changes? Would you try that? What's up, guys? Dr. Emile here with another video. I'm out here on the streets of downtown Toronto on the TMU campus talking to students all about health, naturopathic medicine, and so much more. This video was so much fun to film, and I think that it is packed with value. I loved filming it. I hope you like watching it. Without further ado, let's get into the content. On a scale of 1 to 10, 10 being the highest, 1 being the lowest, how would you rank your day-to-day stress levels as a student here?
It depends on the time. So right now, since it's a beginning week, probably a 5 or a 6. But when it's drawing closer to midterms, it's around 8 or 9.
When you do come to those super stressful times, what kind of strategies do you put into place to manage your stress?
What I've been doing recently is trying to focus on studies early on, having a schedule, meeting up with the profs continuously, going on walks for the most part.
Get outside, stay fit, and manage your time. That's a really big one too, right?
Definitely, yes.
Amazing. Do you take any supplements?
No.
None. Zero supplements. Just pure, just raw dogging it through life. Have you heard of naturopathic medicine before?
No, I haven't.
It's very similar to your family doctor, but 2 key differences. 1, we get the luxury of time, so we get to spend more time with patients to understand the root cause. And 2, we always try a natural alternative first. That doesn't mean that we're anti-pharmaceutical. We just want to try something a little bit less invasive to start. Does that sound like something you'd be interested in?
Probably, yeah.
Well, if you want to learn more, you can like and follow the channel. If you guys were having trouble sleeping, would you select a sleeping pill or a natural alternative?
I guess sleeping pill.
How about you?
Natural. Sleeping pills don't work for me.
NyQuil knocks you out right away?
NyQuil, yeah. Usually like-
Would you rather take some form of prescription energy boost, or would you rather a natural alternative for that?
no, just like coffee. I'm not big on like energy drinks in general. So
Yeah, I take an energy drink here and there, but I don't really drink any coffee besides that.
For mental health support, would you guys first consider an antidepressant medication, or would you consider an alternative option first?
alternative option first.
Yeah.
I've worked in a pharmacy for a while, so like seeing especially like young kids who start antidepressants, it's like a lifetime cycle usually. So
And what do you guys do here at TMU?
nursing.
You're nursing students. Awesome. Healthcare gang. So what I always tell people about naturopathic doctors is that we're just like your family doctor. 2 key differences. 1, we get more time with the patient, so we really get to understand the root cause of what's going on. And 2, we always try a natural alternative first because it's a little less invasive. Like and follow for more. When you guys hear the words natural medicine, what's the first thing that comes to mind?
Trees or flowers,
Trees and flowers. I like that.
plants and stuff.
These guys belong in the 60s. What are you doing here in 2024? If given the option to see a natural doctor or a conventional medical doctor, if you were sick on campus, which one would you pick and why?
I feel like natural doctor because what they're putting in the medicine, like maybe it's bad for your bodies. I don't know.
How about you?
Probably the conventional because I'm probably more familiar with it.
So a bit of a skeptic as to what is in conventional medical drugs, but you are just more comfortable with medical doctors in general because that's what you're used to. So what if I were to tell you guys that naturopathic doctors and conventional medical doctors are very similar in a lot of ways with 2 key differences. Naturopathic doctors get more time with our patients so we can get to the root cause of what's going on. And then we always start with natural intervention first. Appreciate you guys being in the video. Like and follow for more. On a scale of 1 to 10, 10 being the highest, 1 being the lowest, how would you rank your day-to-day stress levels as a student here?
Ooh, I would say probably around like a 4.
A 4? How do you keep it so low?
Definitely because I love just getting involved in the community here, and every single time I leave a class, there's always something going on in TMU campus, right? So yeah, lowers my stress level a lot.
Engaging with the community, being with people, it just really lifts you up.
That lifts me up all the time, yeah.
I love that, man. I love that. I think that really goes to show the power of community. How do you do around midterm?
Around midterms, I just zero in and lock in as well, right? So I focus more, prioritize self-care as well, right? So when I prioritize self-care, that actually helps boost my marks as well.
I
So
love that you said that. What are some of the things that you do for self-care?
that's a good question. So lots of sleep, number 1. I also do the paradoma technique. I'm not sure if you heard of it.
Don't tell me about it.
So it basically means that you study for 30 minutes, you sleep for 15 minutes. So after I just continually repeat that over and over again. And also journaling, other self-care tips throughout the year helps me a lot as well.
Paradoma technique. Man, I'm learning stuff out here on these streets, man. Pleasure to meet you.
Nice to meet you as well.
Like and follow for more. If you had trouble sleeping and you had the choice between a sleeping pill or a natural alternative, which one would you pick?
I would take the sleeping pill.
You take the sleeping pill. Why?
Natural alternatives haven't really been working for me lately.
What have you been trying?
I've been trying to fix my schedule since summer ended, and it's not working.
Time on average you go to bed?
12 to 1.
Why are you going to bed so late?
I just can't fall asleep.
So what kind of stuff are you taking to try and fix that?
I'm just trying to sleep earlier, like at 10, but it's not working. So I feel like a sleeping pill will put me right out.
What if I told you that there were natural options that could work just as well in conjunction with some behavioral changes? Would you try that?
Probably.
I want you to look into things like magnesium, L-theanine, passion flower tea. Have you heard of those before?
Magnesium, yeah, but the other two, no.
Hey, listen, you got your homework cut out for you, okay? Like a ball for more. On a scale of 1 to 10, 10 being the highest, 1 being the lowest, how would you rank your day-to-day stress levels as a student here?
Like, especially during the middle of the semester, I'd say like around a 9 out of 10.
That's high numbers, man. What are your strategies around that time to manage that stress?
Honestly, like, I don't really have any strategies for it. I just work through
You
it.
just power through. Is there anything that you maybe have tried as far as supporting other areas of your health? Do you optimize your nutrition? Do you make sure to stay active?
I'm a pretty active person and I track my calories, so
How about sleep? Do you prioritize sleep?
I try to as much as I can. But during final season, it's probably the least of my priorities.
It's a bit of survival of the fittest around midterms for sure.
Yeah, for sure.
How about supplements? Are you currently taking any supplements?
I'm on creatine right now. I was on ashwagandha during last semester, but now I'm probably just creatine.
Have you heard about naturopathic medicine before?
Don't think so.
Naturopathic doctor is just like your family doctor with two key differences. One, we get the luxury of time, so we spend more time to be able to understand the root cause of a concern. And two, we try natural alternatives first before getting people onto drugs. To learn more, you can like and subscribe to the channel.